and welcome to the Know Your Numbers webinar. My name is Tina Cote. I am a certified wellness coach for Quad Med, and we'll be going through the program with you today. Our program today is going to be discussing the biometric measurements that you may have recently had taken, and if you want to know a little bit more about what each of these numbers mean. So let's first talk about what the big deal is with the numbers that you had measured. So we really live our lives by numbers. We look at stock numbers, we look at phone numbers, we have a million different PIN numbers. But do you know the health numbers that could literally save your life? Well, the biometric measurements that you had taken can do just that. So what we're going to be talking about today are the blood pressure, blood sugar, cholesterol, waist and BMI measurements, body fat percentage, what your health screening consisted of, and some Quad Med resources for you. We want you to be healthy and be happy, and we hope that knowing a little bit more about what your numbers mean will help you do just that. Alright, so let's talk about things that you can change when it comes to your biometric numbers. You can change your high blood pressure, you can change your cholesterol, you can change diabetes, you can change being overweight, you can change a poor diet, you can change the lack of exercise, and you can change your stress levels and tobacco use, alcohol use, but there are some things that you cannot change, like your family history, your gender, your age, and your race. So we're going to start off with a little bit of a pop quiz today. And what you want to do is just as we go through these questions, I'm not going to give you the answers quite yet, but you should be able to get the answers as we go throughout our presentation. So I would encourage you to write down your answers as I ask you each of these questions. So question number 1. What is the recommended range of blood pressure? And here are the answers to choose from. So write down either A, 135/95, B, 120/80, C, 100/60, or D, 140/80. Which is the recommended range of blood pressure? Question number 2. Which type of cholesterol is considered the good cholesterol? Is it LDL or HDL? Write down your answer, and we'll go through that through this presentation. All right, question number 3. What is the recommended fasting blood glucose levels? Is it A, 230, B, 87, C, 126, or D, 159? Question 4. What is considered low risk for waist circumference for both males and females? Is it A, 33 inches, B, 36 inches, or C, 42 inches? Alright, so when we're talking about what the big deal is with our numbers, the first one we're going to talk about today is your blood sugar. So blood sugar or glucose, another way to say that, or another way that it could be written down on your measurements. Diabetes affects 8.3% of all Americans and 11.3% of adults age 20 and older. 27% of people with diabetes, about 7 million Americans, do not know that they have this disease, which is again why it's so important to get your numbers measured, even if you feel like you've been healthy, you've never had an issue. Sometimes these things develop and you may not have symptoms right away. Prediabetes affects 35% of adults age 20 and older and half of Americans age 65 and older. So it's a big deal. Prediabetes is that first step in becoming a diabetic. You can fix prediabetes, you cannot fix diabetes. You can only control the symptoms. So the Center for Disease Control estimates that as many as 1 in 3 U.S. adults could have diabetes by 2050 if current trends continue. 1 in 3. That is a lot. So this is something that you, again, want to make sure that you know your numbers so that we can work on prevention. And if you do have diabetes, it's something we want to work on these symptoms and controlling it and keeping it under control. So what exactly is blood sugar and why is it important to know? So the food that you eat is turned into glucose or sugar for your body to use as energy. And you can see in our diagram here kind of the steps. So your stomach converts food into glucose, and then your glucose enters your bloodstream. The pancreas then produces insulin, and the glucose enters the body effectively, and glucose levels then balance. So your pancreas is going to produce insulin in response to your blood sugar rising. So every time your blood sugar rises, your pancreas secretes insulin, and that insulin helps get that sugar off to utilize for energy. So when you have high levels of blood glucose for too long, that can lead to diabetes. So when your cells become resistant to the insulin, your sugar is going to start building up in the bloodstream. Some symptoms of diabetes can include frequent urination, excessive thirst, unexplained weight loss, extreme hunger, sudden vision changes, tingling in hands or feet, feeling very tired much of the time, very dry skin, and sores that are slow to heal. All right, so what's so bad about having high blood sugar? Well, when your body doesn't produce enough insulin, or your body doesn't effectively use the insulin that's produced, your sugar levels rise and build up in the bloodstream. So right away, the body cells may be starved for energy. And over time, high blood sugar or high blood glucose levels can lead to damaged organs and other health complications, such as stroke, eye damage, heart attack, kidney damage, impotence or difficulty passing urine, and numbness and reduced blood supply, which can affect your feet. These are the things that can contribute to type 2 diabetes: high blood pressure, smoking, a sedentary lifestyle, being overweight, and high fat and cholesterol levels. So how do we measure your blood sugar? Well, a blood glucose test measures the amount of sugar called glucose in a sample of your blood. The A1C test measures what percentage of your hemoglobin, a protein in red blood cells that carries oxygen, is coated with sugar. Okay, so your A1C is about a 3-month average of what your blood sugar is. Okay, so if your A1C was measured and you were, let's start at the normal range. If you were at about 5 or below, that means your fasting plasma glucose was about 99 milligrams per deciliter or less. Okay, and that pre-diabetes, your A1C is 5.7 to 6.4, which correlates to a fasting plasma glucose of 100 to 125 milligrams per deciliter. And if your A1C was 6.5 or above, you're in the diabetic category. You would be classified as a diabetic, most likely by your physician, and that would correspond to a fasting plasma glucose level of 126 milligrams per deciliter or above. So some recommendations here. So the American Diabetes Association recommends a glucose screening for type 2 diabetes for anyone with a body mass index higher than 25, regardless of age. Anyone older than 45. If the results are normal, get screened every 3 years thereafter. Okay. So what are we talking about next in terms of your biometric measurements? Well, the next one is going to be your blood pressure. So for blood pressure, 67 million American adults, or 31%, have high blood pressure. That's 1 in 3 American adults. About half, 47%, have their condition under control, which is good news. But that means that half do not. About 1 in 5, or 20.4%, U.S. adults with high blood pressure don't even know they have it. So that high blood pressure is one of those things where, again, you probably will not have symptoms. if you've had your blood pressure checked and it's run high, and the first thing you say is, I've never had high blood pressure, it's a good idea to get it rechecked to make sure that it is not consistently running high. You can have high blood pressure after periods of having low blood pressure and not even know that it's gone high. So what is blood pressure? Well, it's the pressure in your arteries when your heart beats. Okay, so it's the pressure exerted by your blood against your artery walls. So high blood pressure is when the force of the blood against the artery walls is too great. Blood vessels become narrow or rigid, forcing the heart to pump harder to push blood through the body. When blood pressure remains high, it puts on unnecessary strain on the heart and blood vessels. Okay, so chronic high blood pressure or hypertension, left untreated, can lead to a stroke. It can lead to blood vessel damage or arteriosclerosis, heart attack or heart failure, or kidney failure. So let's talk about blood pressure management. So blood pressure does rise and fall during the day. When elevated over time, it's called high blood pressure or hypertension. So no symptoms of high levels, and it's known as the silent killer because it is not something that you will feel. You may not feel that you have high blood pressure. And these are some of the factors that contribute to high blood pressure. So lack of physical activity, poor diet, being overweight, drinking too much alcohol, tobacco use, and increased levels of stress. Now, how is blood pressure measured? So blood pressure has two numbers. 120/80 that you see there is the recommended range. So anything less than 120 over anything less than 80 is considered normal. Now, the top number is called your systolic pressure, and that measures the pressure in the arteries when the heart beats. So when the heart muscle contracts, which you would assume would be higher. The diastolic pressure is the lower number, and that measures the pressure in the arteries between heartbeats. So when the heart muscle is resting between beats and refilling with blood. So you would expect that to be lower. And again, more than 1 in 3 adults in America has high blood pressure. So if you get your blood pressure checked and it reads high, it is something to pay attention to and to get remeasured to make sure that it is not consistently staying high. So where should your blood pressure numbers be? So again, normal is less than 120 over less than 180. Okay, pre-hypertension is considered 120 to 139, and your diastolic reading 80 to 89. Hypertension, or high blood pressure, stage 1 is considered 140 to 159 over 90 to 99, and stage 2 is 160 and higher over 100 and higher. Now, the hypertension emergency, or in other words, get medical attention now, is greater than 180 over greater than 120. If your blood pressure is reading greater than 180 over greater than 120, you want to see your physician immediately. The American Heart Association recommends a blood pressure screening once every 2 years if your blood pressure reads normal. So, tips to make your reading the most reliable. Make sure that you're seated with your feet flat on the floor. Don't cross your legs. Do not smoke or drink caffeinated beverages. Go to the bathroom prior to the reading, and do not talk during the measurement. All right. The next number that your biometric measurement may have taken was your cholesterol. So let's spend a little bit of time talking about what cholesterol is. Well, cholesterol, a little bit on the numbers, 71 million American adults, or 33.5%, have high LDL or bad cholesterol. Only 1 out of every 3 adults with high LDL cholesterol has the condition under control, and less than half of adults with high LDL cholesterol get treatment. Americans are making progress, though. Between 1999 and 2010, American adults with high total cholesterol decreased from 18.3%. So what is cholesterol? Well, it's a waxy substance that's found in the fats or lipids in your blood. LDL is considered the bad cholesterol, and it transports cholesterol particles throughout your body. Now your HDL, or considered your good cholesterol, is what picks up excess cholesterol and takes it back to your liver to be processed. Now triglycerides are also measured, and they are another type of fat found in your blood. When you eat, your body converts any calories it doesn't need to use right away into triglycerides and stores it in your fat cells. So triglycerides store your unused calories and provide your body with energy, and cholesterol is used to build cells and certain hormones. Because triglycerides and cholesterol can't dissolve in blood, they circulate throughout your body with the help of proteins that transport the lipids. Now, while your body needs cholesterol and triglycerides to continue building healthy cells, having high cholesterol can increase your risk for certain diseases. So having the normal amount is fine. Having too much is going to do some damage. Now, there are two sources of cholesterol, your body and food. 75% from the liver and other cells, and 25% from animal products such as dairy products, eggs, and meat, or food containing these. Now, high levels of triglycerides, LDL, or not enough HDL can put you at risk for coronary heart disease, heart attack, or stroke. And here are some of the factors that contribute to it. Increased cholesterol levels can come from smoking, obesity, a poor diet, a lack of exercise, high blood pressure, having diabetes, or having a family history of heart disease. Nearly 1 in every 2 American women has high or borderline high cholesterol. 62% of those aged 50 and older have high cholesterol. 50% those aged 40 and older have high cholesterol. So let's talk about the different measurements, the types of cholesterol that were measured. Your total cholesterol, or a measurement of all the cholesterol compounds. Your HDL, which is again your good cholesterol that protects your heart and carries the bad cholesterol out of the arteries. Your LDL, or your bad cholesterol that builds up in your arteries and blocks the way for blood to flow. And your triglycerides, which are fats carried in the blood from your food eaten. So excess calories, alcohol, or sugar is where those come from. Now, how is your cholesterol measured? So a blood test is going to show your cholesterol level in milligrams per deciliter of blood. Your total cholesterol ranges, and the desirable, you want less than 199. Your borderline high cholesterol is going to be 200 to 239, and your high risk is going to be anything over 240. The type of cholesterol, HDL, or your good cholesterol, the desirable range is anything over 60. Borderline is 59 to 40, and your high risk range is less than 40. Because again, we want more of this protective cholesterol running around, collecting all the bad cholesterol. Now your LDL, again your bad cholesterol, the range you want here is anything less than 130. Your borderline risk is 130 to 159. And your high risk is anything over 160. Triglycerides desirable range is less than 150. Your borderline is 150 to 199, and your high risk range is anything over 200. The recommendations for cholesterol is to get tested at least once every 5 years. Your provider may decide otherwise based on your individual risk factors. Cholesterol testing does require a 12-hour fast for a blood draw. Next, we'll talk about your waist and your BMI measurements. So your waist circumference, a high waist circumference and too much abdominal fat puts you at risk for type 2 diabetes, high blood pressure, high cholesterol, and heart disease. Waist size, or waist circumference, is a measurement of the distance around the waist. It checks the fat around the stomach and assesses risk for developing heart disease and diabetes. Waist matters more than weight. Muscle weighs more than fat at the same volume. So waist size indicates if weight is more in fat or in muscle. Apple and pear-shaped body types. If you're not overweight, having a large waist may mean that you are at higher risk of health problems than someone with a trim waist. Pear shape is common in women, and the apple shape is more common in men. Well, what is it about abdominal fat that makes it more of a marker for disease risk? Well, it's considered that visceral fat. It surrounds the liver and other abdominal organs. It releases fatty acids, inflammatory agents, and hormones that lead to higher LDL cholesterol, higher triglycerides, higher blood glucose or blood sugar, and higher blood pressure. So measuring your waist circumference helps screen for possible health risks that come with overweight and obesity. So for women and men, you can see the chart below here. If you're in the low risk range, women, you'll have a waist circumference of less than 31.5 inches. For men, you'll be below 37 inches. In the moderate risk, women, you'll be between 31.5 to 35 inches, and men 37 to 40 inches. In the high risk range, women would have a waist circumference of over 35 inches, and men over 40.2 inches. Now, your body mass index, or your BMI, is a measure of body fat based on height and weight that applies to adult men and women. You can look at the classification chart here of underweight, normal, overweight, and obesity to see the corresponding numbers for body mass index. Having a high BMI and or waist circumference puts you at a higher risk for a number of health problems. Here are a few listed here. Idiopathic intracranial hypertension, stroke, cataracts, coronary heart disease, diabetes, dyslipidemia or high cholesterol, hypertension or high blood pressure, severe pancreatitis, certain cancers, phlebitis, gout, skin issues, osteoarthritis, gynecological abnormalities, gallbladder disease, non-alcoholic fatty liver disease, and some pulmonary disease. Here are some recommendations. You want to make sure that you're measured by a trained medical professional as often as your provider recommends. Also, make sure to get measured when you're taking an initiative to manage your weight so that you know where you're starting from and if you're making progress. If you have concerns that your body mass index is not accurately measuring your body composition, then make sure that you're continuing to measure your waist and your BMI. Another body fat measurement can be measured by taking your total mass of fat divided by your total body mass to equal your body fat percentage. It includes essential body fat and storage body fat. Now, your essential body fat is necessary to maintain life and reproductive functions, and your storage body fat is fat accumulation in adipose tissue, part of which protects internal organs in the chest and abdomen. Again, we all need a certain level of fat in our bodies to stay healthy. The body fat percentage is a measure of fitness level, since it is the only body measurement which directly calculates a person's relative body composition without regard to height or weight. Okay, so you can look at the chart here to see the different levels of body fat measurements. For women, your essential fat range is 10 to 13%, and men is 2 to 5%. The acceptable range, or the highest range that you would want to be in, for women is 25 to 31%, and for men is 18 to 24%. So what's the big deal about a health screening, and why should you have one? So having a yearly health screening will help you uncover any potential health issues early so they can be treated more successfully and at a lower cost. Having an understanding of your health status and biometrics can allow you to become your own health advocate. If you know your numbers from year to year, you now have a running list of what is normal for you. And if you start to feel maybe you're not feeling well, or if anything starts to happen with your health, you now have a list of what your body typically runs at for all of these levels. Your doctor will then be able to quickly tell if something is running out of the norm for you. These are the recommendations of when you should get tested for each of these biometric markers. Take a look at these charts for women, and I'll forward to men, and you can see when you should be getting each of these levels checked. Of course, all of the above are recommendations if you've achieved normal readings, without other risk factors. Otherwise, be tested as your provider instructs, which may be more often. And here is the chart for men. All right, let's move on to the quiz review. I hope you took the quiz earlier and wrote down each of your answers. So the first answer is for blood pressure, what is the normal recommended range? The answer is B, 120/80 milligrams mercury. Question 2, which is the good cholesterol, and that is B, your HDL. 3, what is considered the healthy glucose number? The answer was B, 87. And a healthy waist circumference for both men and women would be 33. The answer is A. I hope you got each of those questions correct. And if you didn't, I hope that throughout the presentation that it did help you find those answers. And now you're a little bit more clear of each of these markers. So do you know the numbers to save your life, and have you gotten your biometrics checked? If you need to get your biometrics checked, or if you have questions about your numbers, please feel free to contact an appointment with a wellness coach. And if you're eligible for the QuadMed Health and Wellness Center, contact patient services to get scheduled. That number is 1-888-417-1001. I hope you've enjoyed today's presentation and it helped you understand a little bit more about what each of your biometric measurements meant. Again, if you have questions about QuadMed or scheduling an appointment, or would like to try and find services for a wellness coach in your area, call patient services at 1-888-417-1001. Thanks.